find the one that uses one needle and you find the master. This is a very ancient saying from China. It's possibly thousands of years old, and there is a lot of truth in it. The more experienced the acupuncturist, the tendency is that the less needles that they will use. And this is counterintuitive at first, but after a bit of explanation, it really begins to make sense, because when you look upon every needling and every point as a command, then diagnostically, if you can find one needle to do everything that you need to do, so suppose the stomach energy is a little bit overactive and there's a little bit of reflux, and the tendency is with reflux you also have a little bit of a deficiency in kidney energy, which is where the stomach acid comes from, and then maybe we find a little bit of stagnation in the system of liver, and so on. If you can find one needle to put that right, then this command to the body is loud and it's clear. Acupuncturists that have perhaps less experience, they tend to hedge their bets, and so they also, okay, there's a little bit of deficiency in the energy of the spleen, so we'll a couple of needles here. The large intestine's overactive, couple of needles here. The liver is really commonly deficient in a lot of people, so we'll put a couple of needles in to support the liver, and maybe by the end of the treatment they've done 15 needles. And it's easy to see when you look upon every needling as a command. If you give the body 15 things to do, it is not going to take those things on board as easily as it would as if you just give it one command, loud and clear. It knows exactly what it needs to do and it does it. Using many needles has a very strong effect on the body, so especially with weaker patients, you can find that they feel strange after treatment. Maybe it makes them feel tired, maybe it makes them feel just not good, it's just not good. Using less needles is much more subtle, and it's much less profound, the effect on the body. So it's a bit like a carbon neutral footprint in a way. You could say that acupuncture that uses lots of needles is using a lot of carbon, but acupuncture that only uses one needle, it's carbon neutral. Its effect on the body is very small, but its potential to make changes in the body is much greater. I saw a patient yesterday. She came to see me 4 years ago with a busted disc. I think it was it's a soft tissue injury. She just had a lower back soft tissue injury, and it took me 5 or 6 sessions, and then she had no pain anymore, and then she went off. She phoned me last week and she came in yesterday, and it turns out that she's developed a problem in her knee, in the patella ligament, and I put one needle in her arm, and I said to her, I'm so glad that I've treated you before and that you know how it goes, because if you were a new patient and you have come in with a knee pain and I put one needle in your wrist, you'd think I was nuts. But she knows how acupuncture is. She knows that from a certain perspective it can look very strange. Often the needles don't go anywhere near where your problem is. It's all about how to affect the energy of the body, whether you want to direct a flow of chi to where it's weak, whether you want to take something out of the body. And then also there's the ramifications on the pleasantness, if you want to call it that, of the treatment. If you lie down, I do a bit of diagnostics. I put 1 or 2 needles in you, and then you fall asleep for 20 minutes, and then you wake up, treatment's done. This is a very pleasant experience. People love their acupuncture. But if you're being covered in 20, 30 needles, which is what some people do, most needles don't really hurt, but some of them do, a little bit. And then lastly, it's a lot easier to lose a needle. If you're only using 1 or 2 needles, you don't lose needles, and as far as I know, I've never lost a needle in my whole career.